With an infant, it's a little bit different technique because much smaller body, so you don't want to do unnecessary harm. But the basic principle is the same. We want to circulate oxygenated blood. To check responsiveness on an infant, we smack them on the foot because it's a very sensitive area. So we smack them on the foot and we shout to get their attention. Hey, are you okay? If we don't get any response, then we would call for help or send for help. Then we would look, listen, and feel for breath. Feel the chest for any movement. Minimum of 5 seconds, maximum of 10 seconds. If there's no breathing, then we'd give 2 little breaths. But with an infant, you put your mouth over the nose and the mouth. Then after we've given those 2 breaths, we maintain the airway and we check the brachial pulse. It's in the upper arm, just under the biceps muscle, about halfway between the elbow and the shoulder. And it's easier to find that brachial pulse than a carotid pulse like we do with an adult or a child. If there's no pulse within 5 to 10 seconds, then we would do compression. But as I said, with a smaller victim, we can't use the whole heel over hand. So we would use 2 fingers vertically just below the nipple line and do compressions at the same rate as we do with the adult, 100 compressions per minute. So, and we want those compressions still to be hard and fast. Because what we're trying to do, right, not too hard, but the compression depth for an infant is about 1/3 to 1/2 the depth of the chest. With an adult, the compression depth is 1.5 to 2 inches. Now, that's with a single rescuer. But let's say a second rescuer shows up on the scene, and they bring them with them a crash cart or an ambulance, for that matter, and they have a baby ambu bag or an infant ambu bag. They would provide breaths that way from above the victim's head, and the person doing the compressions would move to the feet. And instead of doing compressions in this way, they would do 2 thumbs with fingers encircling, still keeping the baby on hard surface, and do compressions at the rate of 100 per minute, but the ratio changes to 15 compressions to every 2 breaths. Now, I like the idea of using the ambu bag when it's available over any other technique because, as I said earlier, we're using normal air with a higher percentage of oxygen. We would continue to do 2 rescuer CPR until the baby either recovers or advanced care arrives on the scene. Most of the time, what we've really been able to do with proper CPR techniques is stabilize the victim, whatever the age, until advanced care arrives. That's pretty much the basics of CPR.
Now, a lot of people are reluctant to do CPR because of the possible risks of contracting a disease. Now, what are the chances of actually contracting a disease while performing mouth-to-mouth?
Well, everything I've been able to learn indicates to me that the chances of you getting a disease doing mouth-to-mouth for a limited period of time are extremely small. I personally don't believe I'd hesitate if someone was in the process of dying to do CPR, including mouth-to-mouth. But there are so many devices available now, like some that I've shown you, like this pocket mask or a flexible barrier or an ambu bag. But I even had a student, a nurse, who was trained in Europe, tell me that if she had nothing else, she'd pull her shirt over their mouth. It would be some kind of a barrier, and if nothing else, would give her some peace of mind.
Wow. That was one of the best CPR demonstrations I've ever seen.